is a very lovely patient that I saw last week before down in beautiful Tasmania. And this is the horse that I showed in the very beginning of the presentation saying, what is the problem? So I can tell you that this horse definitely has dental disease, but I can't tell you that he doesn't have any of the other diseases. I'm pretty sure he didn't have choke, but I can't tell you for sure he didn't have any of the other diseases because the symptoms that he's showing are pretty non-specific. As horse owners, it is our responsibility to look out for things like this. I do need to say that for dental disease in the horse, because they are stoic and herd animals, the most common clinical symptom of dental disease is nothing at all. 60% of our horses over age 15 are going to have dental disease, and the most common thing you'll see as a horse owner is absolutely nothing. So we need to be better at this. We need to be flipping their lip. We need to be getting them minimum once yearly veterinary checks with a complete and thorough oral exam, as well as floating the teeth. So these are some photos here of this lovely boy, and you can see that, oh, I'm using the cursor again. You can see that the underneath those gums is quite bulbous. It's very red. We've got some gum regression. On the top right, you can see one of those draining pustules. That's where the pus drains out. And these are his x-rays down here on the bottom. So lots of holes in the teeth. We've got some periapical halos, and that's when the bone is eaten away. And that's because pus is very destructive. So that pus has gone in and eaten, infection has gone in and eaten away that bone. And you can see in the x-rays on the bottom, on the top right x-ray, we are missing most of the root of this. So the good news is that we were able to take all of his painful and infected teeth out. So these are all of the teeth that we took out of this lovely boy. We took out all 12 incisors. This one broke during extraction, and we took out one of his canine teeth. We left the other canine teeth in there. These weren't our last x-rays, but they're our second last x-rays, and we can still see that we've got some little bit of tooth left in here, and we were able to go and get those bits of tooth and take it out. But these guys are just incredible. And I can tell you in my experience of treating EOTRH in horses that really extracting those painful teeth is the only thing that works. There's a few other things we can do to maybe take the edge off the pain, but this is really the only thing that works. I love doing these cases because they are different horses afterwards. They are different personalities, and it's not until you take away all those painful diseased teeth that you realize how much pain they were in beforehand. This absolutely changes their lives.